Hi everybody, my name is Dr. Scott Giacomucci. I'm the director and founder of the Phoenix Center for Experiential Trauma Therapy in Media, Pennsylvania. I'm board certified in clinical social work, in sociometry, psychodrama, and group psychotherapy, and my specialty is in trauma and traumatic stress. I'm really excited that you found this video, and I hope that you do find it helpful in your work. So in this video, I want to take a couple minutes and talk about the connection between addiction and trauma. So the way that I think about it is that addiction and trauma really exist within a cyclical relationship, meaning that they fuel each other. Oftentimes, one experiences trauma or adversity, and in an attempt to manage the anxiety or traumatic stress caused by the trauma, they might turn to substances or alcohol to numb, to detach from their experience, to suppress the memories or deal with the pain. Sometimes that can develop into a dependence or a substance use disorder, an addiction, alcoholism. And oftentimes the lifestyle that comes with being in an active addiction makes it much more likely that someone will experience more trauma, car accidents, physical injuries, interpersonal violence, gun violence, overdoses, and traumatic loss. These are much more common for someone in active addiction than for the average person. And the compounding experiences of trauma, of adversity, only lead to more and more substance use, alcohol use, and relapse. So in part of my work in an addiction inpatient center, Meermont Treatment Center, when we created programming for relapse prevention years ago, one of the things that was discovered was that just about everyone who was identified as having chronic relapse syndrome or being a chronic relapser, someone that had been in and out of recovery programs and frequently lapsed back into active addiction, that all of these patients had unresolved trauma, unresolved loss, issues with abandonment or neglect, childhood adversity that wasn't being addressed. Oftentimes, the inpatient treatment center was saying, it's too early on, we can't address the trauma here. We'll send you to a residential or a partial hospital program and you can address your trauma there. And then a client would discharge and they would get to the partial program and the therapist there would say, it's too early on in your recovery to address the trauma and you're in this vulnerable transition from living in a facility to living at home or in a recovery house. We can't address the trauma now. Things are too unstable. When you get to IOP, you can deal with the trauma. And then the client will discharge and get to IOP, intensive outpatient, which is usually three-hour groups a week. And the therapist there would say something similar. It's too early to address your trauma. You're too early on in your recovery. You need to get plugged in to more social support. You need to have the addiction under control before we can address your trauma. You can do that when you get to a one-on-one therapist, an outpatient who specializes in trauma. And what was happening is many clients weren't making it all the way through the treatment continuum prior to experiencing a lapse or relapse. And this kind of revolving door emerged within the field. That it's not uncommon for me to work with clients who have been in 10 or 20 or even 30 different substance use treatment programs, which is really sad. So there's this unfounded idea within the field, the addiction field, that the addiction has to be treated first before the trauma, which there's no research to back up. Treating addiction and trauma concurrently at the same time is the most effective approach according to the research. Now, of course, there's some limits to that statement, that if somebody is actively under the influence, it's going to be hard to do trauma work with them. If somebody continues to abuse substances or drink, really use any kind of addictive behaviors, they're going to have less access to some of the content, the emotional and traumatic content related to memories of the past. So it'll be more difficult to do the trauma work. But it is important that addiction and trauma are treated together. They really do go hand in hand. Many describe addiction itself as a traumatic experience. It has many of the same characteristics as other types of trauma in terms of the sense of powerlessness, helplessness, the way that it overwhelms one's ability to cope, the way that it impacts us biologically, psychologically, socially, existentially, and spiritually, just like trauma does. So addiction and trauma really do go hand in hand. One of my favorite speakers, Dr. Gabor Mate, he says that it's impossible to understand addiction without asking what relief the addict finds or hopes to find in the drug or the addictive behavior. So many experts are suggesting that for most people, addiction is a result of trauma, a result of childhood adversity, a result of loss or traumatic loss, abandonment or neglect, which makes sense based on my clinical experience over the years. It's hard for me to think of a client that I worked with in addiction treatment that did not have some sort of prior trauma, family dysfunction, attachment trauma, abandonment or loss prior to the onset or the progression of their substance use or alcohol use. So addiction and trauma really have a cyclical relationship with each other. Now, 70 to 80% of folks who are in treatment for addiction, in treatment for a substance use disorder, report a history of trauma. 70 to 80%. That's 7 or 8 out of 10 people report a history of trauma. So these are self-reported numbers. Now we know that part of the nature of trauma is that it's difficult to talk about. It's something that not everyone is going to disclose, especially on a questionnaire or in a research study. So these numbers are probably lower than the reality because they're self-reported numbers. And part of the other nature of trauma is that it impacts our memory at times. It's not uncommon for traumatic memories to be entirely repressed or suppressed. And it's also not uncommon for someone to experience something that most other people would identify as trauma and that they haven't yet labeled as trauma, which is separate from having a traumatic response to it. Of course, based on cultural factors and belief systems and ways of being in the world, not everyone who experiences the same thing experiences it as a traumatic event. And dissociation and denial are quite common, minimization, quite common ways of coping with trauma, avoiding talking about it, avoiding labeling it. So I say all this just to acknowledge that although the statistics show that 70 to 80% of people in treatment for addiction have a history of trauma, the actual numbers are probably much higher than that. Folks with substance use disorder are 7 to 12 times more likely to also have PTSD, post-traumatic stress disorder. 7 to 12 times more likely than someone who doesn't have a substance use disorder. So that's a pretty strong connection between PTSD and addiction, that you're 7 to 12 times more likely to have PTSD if you also struggle with addiction. So because trauma really impacts our ability to self-soothe, our ability to feel safe, our ability to regulate ourselves and our emotions, addiction, substances, alcohol, are sometimes solutions to this problem, temporary solutions, in that they are outside things that allow us to change our mood, to regulate our emotions, to numb, our pain. Actually, in some of the neuroscience research, they actually found that when they take a brain scan of someone who is experiencing physical pain, and they take another brain scan of someone experiencing emotional pain, they can't tell the difference. You can't tell whose brain is whose. Physical pain and emotional pain look the same in the brain. They use the same mechanisms, which is one of the reasons why opiates and other drugs work so well at numbing emotional pain. They're designed for numbing physical pain, but because social and emotional pain uses the same mechanisms, we already have those opiate receptors built into our brain. Our body and our brain actually produce natural opioids as organic and natural painkillers in response to danger, threat, or injury. These are just some of the interesting neuroscience findings that shed light on why addiction and trauma go hand in hand so often. PTSD is actually the most common co-occurring disorder with alcohol use disorder. And about half of the folks who are diagnosed with PTSD also meet criteria for a substance use disorder. So this is pretty strong connection between the two conditions, which is kind of interesting in that usually in the addiction treatment world, when we talk about co-occurring disorders, usually we're not talking about PTSD in those discussions. Unfortunately, the focus in those discussions is about depression, about anxiety, about bipolar disorder, about personality disorders, about ADHD, when really addiction and trauma as co-occurring disorders really go hand in hand. So alcohol, of course, is a depressant of the nervous system, and many of the symptoms of PTSD manifest as an overactive, overreactive, and over-aroused body and nervous system. So it logistically makes sense that somebody might find relief in alcohol in terms of reducing their PTSD. So this connection between alcohol use disorder and PTSD logistically makes sense. Now, there was a groundbreaking study 20, 30 years ago called the ACE study, the Adverse Childhood Experiences Study. And this was a simple 10 questionnaire. All of the questions said, before your 18th birthday, did you experience this? 3 of the questions were about abuse. 2 of the questions were about abandonment and neglect. And the other 5 questions were about family dysfunction, attachment traumas, relational trauma. Now, when they correlated the data and examined and analyzed the data from this ACE study, they gave this questionnaire to thousands and thousands of people, tens of thousands of people. It's been replicated in various countries and communities around the world. There are certainly some limitations to the study and critiques of it and ways that it's been modified to be more culturally appropriate and fitting for different communities. However, in the original findings, one of the things they found is that the higher number of ACEs somebody had, the more yeses on that 10 questionnaire, the higher their increased chances of mental health issues, suicide attempts, substance use and alcohol use, as well as other medical issues. So somebody who scored 4 different types of ACEs, had an ACE score of 4, their chances of experiencing alcoholism as an adult went up 500%, and their chances of using IV drugs as an adult went up 1,300%. Pretty strong connection there between childhood adversity and adult alcohol and drug use. Now it gets even worse when we go to 6 or more ACEs. I think this was specifically for male participants in the study. Someone with 6 or more ACEs had a 4,600% increased chance of using IV drugs as an adult. So again, pretty strong connection between addiction and trauma. So when you're seeking treatment for addiction or referring a client or loved one for treatment for addiction, it's also important that you find a program that has a trauma component, a trauma-informed program, but also a program that has trauma-focused and trauma-specific services. There's another video on my channel here that describes the differences between trauma-focused and trauma-informed services. If you're unfamiliar with that, I encourage you to check out that video. There are many different types of treatment for trauma and for addiction. The most popular approach is talk therapy and different forms of talk therapy. Though based on some of the research related to trauma and the ways that it impacts our body, impacts our brain at levels below thinking, below cognition, below verbal processing. Some of this research challenges us to consider alternatives to talk therapy, to consider the experiential therapies, the creative arts therapies, the somatic and body-oriented approaches. So I'm a big advocate for these types of therapies, such as somatic experiencing, Gestalt therapy, internal family systems therapy, music and art therapy, drama therapy, dance movement therapy, and psychodrama. These approaches, rather than relying entirely on talking or thinking, they employ different creative ways of expression, different symbolic ways of talking about and expressing the ways that trauma impacts and lives within someone. And they bring the body and the nervous system into therapy. Another highly recommended and effective approach for trauma and PTSD is EMDR therapy, eye movement desensitization and reprocessing. EMDR is primarily used as an individual therapy. I'll place some links in the description below where you can read more about some of these different approaches. Now, some other approaches for healing from trauma that are effective include yoga and meditation. In some of the research on yoga, they actually found that yoga was more effective at reducing PTSD symptoms than any medication that's been researched. So this was a huge finding and really supports the use of yoga and meditation in healing from trauma and healing from addiction. And it makes sense if you think about it. Addiction and trauma are both characterized by a lack of safety in one's body, a lack of safety in the world, a lack of safety in oneself, and attempts of detaching, dissociating, avoiding from one's present moment, one's present experience, getting out of one's body. Whereas meditation and yoga are practices of being in your body, practices of finding safety in the body, practices of learning how to tolerate discomfort and distress just a little bit longer, knowing that the yoga pose is going to end soon. So effectively, yoga and meditation are ways that we can increase our tolerance, our window of tolerance for distress, and ways that we can reduce our experience of traumatic stress or other types of stress, ways that we can support recovery from addiction and trauma. So if you found this video helpful, I encourage you to check out some of the other videos on my channel here. There are a number of videos about trauma, about PTSD, about post-traumatic growth, about addiction, and some videos specific to ways of healing from trauma or addiction.